I keep the time, Dr. Noor?
No, I have kept already for the next. Let's
Yeah,
start,
no
Dr.
problem.
Husna.
Yes. Good afternoon.
Good afternoon.
This is Dr. Muzna. I'm one of the baby doctors. Hello.
Hello. Yes.
I believe this is Mrs. Aziza, mother of Mohsin.
Yes, doctor, this is me.
Yes, Mrs. Aziza, thank you very much for coming over here to discuss about Mohsin's health. Is it fine? Can we discuss about it?
Yes, sure, doctor. I am desperately waiting for this meeting to discuss with you.
Before starting the meeting, I would just like to ask, would you like someone else to accompany you, or you're happy being seen alone?
No, no one is there with me. Only I am here. My husband has gone for the work. So you can continue, doctor.
Okay, fine. Thank you. Over here, I just wanted to ask you, Mrs. Aziza, that presently I know that Mohsin is having a severe headache since 5 months, right?
Yes, yeah. He has headache from 5 months, which is making me too much worry.
Okay, what is making you so much worried? I wanted to actually discuss about his diagnosis, like what are we thinking about Mohsin, and how do we go about that? Is it fine? Can we discuss?
Yes, sure, doctor. Actually, from 5 months, he has this headache. He says all over the head, he has headache, and he starts crying due to the headache, which makes me
Okay,
worried. I don't know
okay.
what's happening with him, why he's like this. So I did not approach anyone till 5 months. I was just going to the GP. But
Okay.
now I am afraid maybe something in his head. So I came, maybe you will do some imaging for him to improve.
Okay. I do understand your concern, Mrs. Aziza, because 5 months you have been with this, with Mohsin having this headache, right? Uh, I would I would like to tell you that if you've been to the general practitioner, in fact, he has done all the investigations, and he has completely worked about. He's done the workup of Mohsin. Do you know what does he think, or has he communicated you regarding what he thinks about Mohsin?
Yeah, he told me that he has nothing. All his investigations are normal and he's fine. But I am not satisfied. I can't keep seeing my child like this, doctor. Do something. I think you
Do I
have to make an imaging for him. I want to do
com-
CT scan for
yes.
him.
Yes, Mrs. Aziza, I'm completely empathize with your situation, that it is a difficult situation. And in fact, the general practitioner, and in fact, looking at Mohsin and knowing the entire history, we know that he's having something called as tension headache. Have you heard about tension headache, or someone in the family having so, or you've read something about it?
No, I don't know anything about tension headache, but as the name suggests, he is in some tension. But I don't think this is the only cause to cause the headache for 5 months. Maybe once or twice when the child is stressed, he may have not continuous for 5 months. So I
Okay.
am not convinced with this.
Yes, Mrs. Aziza, I do understand that 5 months is a long time, and we require you to help us so that we can help Mohsin, right, Mrs. Aziza?
Yes.
We are at your side, and in fact, you need to help us to trigger, to find out the trigger factor, that why is he having this headache? What is making this? Because as I've seen, during the weekends he doesn't have, and during the school time he has. So you need to help me to know why is he having that in the school time, Mrs. Aziza.
Actually, but he's going to the school happily and he's doing everything fine at the school. His performance is very good. I
Hmm.
don't know. So I think that something is there in his head, which is the reason for his headache. That's why I am asking you that
I understand,
we
Mrs.
have to
Aziza,
do
your
something to
concern.
check out what is the problem with him.
Yes, Mrs. Aziza. Actually, had it been some big problem, he would have had headache throughout, and not just sparing the weekends. And as we know, you are requesting for an imaging scan. There are few danger signs that are present, or as we say, that some danger signals after which we need to do, which we feel Mohsen does not have. Do you know anything of these danger signs or some alarming symptoms when we do these scans? Do you know anything about that?
No, no, I don't know, doctor.
As we know that Mohsen is growing well. He has no other issues. In fact, he is not having an early morning headache. And as you, does this headache wake him up from his sleep, Mrs. Aziza?
No, no, he doesn't wake him up from the sleep.
No, agreed. And he does not have weakness of any side. He does not have fits. In fact, what about his vision? As Mrs. Aziza, can you tell me any about thing about his vision,
No,
about
no,
his
he is
eyesight?
fine. He is fine. Nothing with his vision.
Yes, so Mrs. Aziza, as I'm trying to tell you that most of the alarming symptoms for him to get the scan are not present. Are you with me, Mrs. Aziza? Can you
Yeah, yeah, I
understand?
am with you.
Yes. So that's the reason we are not going ahead with the scan. And we have thought of a tension headache because probably there is this stress factor that he must be having, and we need to find that out.
6 minutes, 3 minutes left.
Okay. So, Ms. Aziza, about his sleep, about his activity, about his exercise, everything. If you could tell me more about that, I will try to help you about knowing the trigger factor.
Actually, doctor, this headache for 5 months, is it not enough for you to do the imaging? You want all these things like vomiting, headache, and something in the vision. I think now he has only headache. Tomorrow he will have some problems like vision. He may develop vomiting. I really think that he has something inside his brain. Is
Mrs.
it not
Aziza,
enough 5 months of headache? You still want him to suffer alone?
no, Mrs. Aziza, we would definitely would not like him to suffer. In fact, probably if there's a trigger of factor, the tension is there, then this is going to go, forward. This tension is going to stay. So hence, I would like to tell you that
We can't hear you, Dr. Musna.